First, though, we have some health headlines. Joining us now is Professor at Northwestern University Medical School and WGN Morning News medical contributor, Dr. Lauren Streicher. Thanks for being here.
Good morning.
All right, first thing, sleep apnea can affect your eyesight?
I know, this was news to me. You know, sleep apnea is really common, actually. Somewhere between 25 and 35 million Americans have it. Most of them don't know it. This, of course, is a sleep disturbance where you actually stop breathing at short intervals throughout the night. And people that have this, you know, they're tired, they're exhausted all day, and it is associated with serious medical problems like high blood pressure and heart disease and diabetes and stroke. But it turns out it's also associated with eye problems and vision problems, which I didn't know. So there was a new study that just came out from a group of ophthalmologists, and there's a number of issues. One of them is something called floppy eyelid problem, where basically the eyelid is floppy, it gets loose. And the problem with that is it kind of everts up a little bit so that there's a lot of irritation and inflammation and potentially damage to the eye. But the bigger issue is that whenever you stop breathing for those teeny little intervals, you have a drop in oxygen, and over time, this can affect the blood vessels in the eye. It can impact the tissue, including the retina. And this can be over the long term, very dangerous. The group that is at the highest risk are diabetics, because diabetics already are at risk for retinal disease and blood vessel problems. So it's a double whammy if you have diabetes and you have sleep apnea, which is not uncommon. So this is the message. If you have sleep apnea, get your eyes checked.
Oh.
And if you find that you're having eye problems, particularly floppy eyelid, it is an actual diagnosis called floppy eyelid, or retinal problems, you may want to have a sleep study to make sure that you don't have sleep apnea as well, because it's treatable and potentially really dangerous.
Okay.
I read a new study about how estrogen might not be getting absorbed.
Right. So a lot of women who are using postmenopause hormone therapy are using a transdermal product, meaning through the skin. Sometimes it's a patch or a spray or a gel. And a lot of these women, and I and a lot of other menopause experts have noticed this over the years, is that they continue to have problems. They continue to have hot flashes and brain fog, and they're not sleeping. And then we check a level, and it seems like it's lower than it should be. So we've always kind of said, gee, some people seem to be poor absorbers, but it's never really been studied. Well, there was just a huge study that was done in the UK, 1,500 postmenopause women that were using transdermal estrogen, through the skin estrogen, and what they found is 1 out of 4 of them, even though they were taking higher, you know, the standard dosages, 1 out of 4 of them had subtherapeutic levels, meaning they weren't getting enough. So not only does this translate to maybe continuing to have those hot flashes and brain fog and insomnia, but a lot of people are taking hormone therapy for bone health and to prevent cardiac disease down the road, and they may not be getting enough. So routinely, we don't measure blood levels unless someone is having problems on hormone therapy. But this is kind of changing my thinking, and women who are using a transdermal estrogen, especially if they're still having symptoms or if they're concerned about their bone health, they may want to get a blood level. And a lot of people will say, well, my doctor's not going to go for it. On my Substack, I have the link to the article so that people go to my Substack, they can get to the link to the article, show it to their doctors, and check that out.
All right, what about measles?
Oh my gosh.
We hear about it's in Texas, it's spreading. How is it here in Illinois?
We are in great shape in Illinois right now.
All right.
And the reason is because in Illinois, we're vaccinated. This is one of the high vaccine states, which is not the case where we're seeing these cases come out in New Mexico and Texas. So this is great, and this is very reassuring. Having said that, it is spreading like wildfire, and it will come to Illinois because people travel.
Right.
And keep in mind that even if you're vaccinated, you are only 97% protected. You can still get measles. A lot of people can't get vaccinated because of either a medical condition or maybe they're too young. So the number one message is if you're not vaccinated or if you're not sure, you need to get vaccinated. You need to get vaccinated. So it really depends on what year you were born, the likelihood. If you were born before 1957, there's a good chance you were not vaccinated, but there's also a really good chance that you're immune because of exposure. The tricky years are 1963 to 1968, because if you were born during those years, you likely got a form of the vaccine that may not still be working. After that time, you should be okay. So if you're not sure about your vaccine status, you have a few different options. Number one, you can always get your blood levels checked to see if you're immune. Number two, A lot of people are just saying, just get revaccinated. It's not a big deal. Get another vaccine. It also turns out that Illinois has a registry, and you can go to the vaccination registry in Illinois, and if you got your vaccines as a kid in Illinois, you may well find it there. And one other last helpful hint is that if you are a healthcare professional that's worked in a hospital, they generally screen you for all that stuff. You won't even remember because we have so many tests when you get employed by a hospital. But that's how I realized that I'm immune, because I thought, okay, well, when I started Northwestern years ago, they checked me out. But if you're not vaccinated or you're not immune, get vaccinated. There is absolutely zero relationship with autism. That is not anything that is felt by any scientific study or doctor. It's important to keep up to date with reliable information. You cannot go to the government websites. Doctors are all in agreement that if you want accurate, up-to-date information, the place to go is not our government websites right now, and it is very important to keep track of this to know where it is, how it's spreading, and what you can do. And no cod liver oil and a good diet will not prevent measles. You need to get vaccinated, period.
All right, you can follow Dr. Stryker on Substack. Thanks again for joining us. Good to see you.
Thank you, doctor. Time now for On Town.
Hey, Anna.